For people who don't know exactly what it is, just kind of briefly describe the exchange and how that might work for an average Arkansan family.
Well, the exchange, one real typical explanation of it, it's kind of like Travelocity, where you can go into, on an automated basis, go in and buy travel tickets, airline tickets, on a wholesale basis, on a mass basis, and it's more competitive. Well, the exchange will take an employer that has 3 employees and couple those 3 employees with thousands of others. And the lasting effect of that will be several things. One, it should lower the cost because it's wholesale, so to speak. 2, it enables you to get a lot better coverage than you can get on your own with just 3 people. That's overstated when you say Travelocity, because also there's a lot of people in Arkansas that are not going to go through the internet to buy insurance, and so while we will not have the exchange in Arkansas, we actually lost that. It's going to be operated by the federal government. We'll have the connector to it, and that's called the partnership project right now, and we will be able to assist Arkansans to initiate a way they can buy their insurance through the exchange, and we will facilitate that transaction for the people. Now, we have this grant that we're just now initiating, and it starts with a study, a planning process to how best to do that for Arkansans. We'll also have education to tell the people of Arkansas that this is available to them. All of that is a pretty long-term project. We've got to be ready by 2013 to be able to start processing these policies. So it's really good news for people who are on their own now that will be able to be in a larger group to purchase protection. There's controversy about that, but when you boil it down to what's best for Arkansans, this is really a good news situation. It's a work in progress. It could change based on the election, on the federal courts, and a lot of outside developments. But what we're trying to do as your insurance department is to get ready to help the Arkansans go through this process. We'll set up a navigator program that's to assist people. The educational process, that's going to be federal funded. We're also going to have the regulatory authority over the agents and the companies. So if something goes wrong against the insurance regulations, your insurance department will be able to step in on behalf of the Arkansas consumer. There are things that we have no control over. Number one, the exchange itself will not be in Arkansas. Number 2, this is a federal program. Any changes that are initiated, affordable health care will have to be the United States Congress. And it will change. Things will change as it progresses.
It's a federal program, but you'll be buying private insurance.
Exactly. Right. And there's going to be an integration, tax credits, and going to be an integration with Medicaid that will help Arkansans, will subsidize them going into this program. The plan will be that there'll be 400,000 more people who will be insured at the end of the day. Now that'll be a process that'll take more than 1 year to get there. Mm-hmm. That you've got to, recognize that over 20% of the people in Arkansas don't have any type of insurance. I'm not talking about the people who have Medicaid, which is the insurance, the public program for people at a certain poverty level. A lot of these are working Arkansans that either work for small companies or work on their own, and they don't have the availability of health insurance. This is going to bring that to them.
And to the idea of allowing a lot of people to come together is to drive costs down. Is that
exactly? It's like the whole premise of insurance is you have a lot of people paying into a fund. That's the insurance fund, and there's a few of those people who are going to draw out of that fund. So the more people you have paying in, the lower cost it should be for everybody. It's a law of numbers. And so we also need to have young people that they're subject to certain medical expenses. That one accident can cost you hundreds of thousands of dollars, but young people really don't. It's hard to conceive, you know.
Mm-hmm.
With the common term is pretty trite. It says, well, young people think they're bulletproof.
Yeah.
So we've got to bring that cost down where young people will want the protection, and it will be competitive for them. We know that when you go to a hospital in Arkansas, yes, they do. They are compelled to take you, whether you have insurance or not. But a 3-day stay typically is $30,000-$40,000 if you know. And if you're really sick, let's say you stay 10 days, and that's $107,000. That'll bankrupt most young people and a lot of older people. So that's a real serious situation. The two things that cause bankruptcies for Arkansans: credit cards, sickness, uninsured sickness. So at least this is a way to protect the future of our young people, and I hope it works out. It's gonna have to be modified as it goes along.
As this is being developed, what are some of the steps that are being taken to make sure that kids are getting all the care that they need and that they're going to be taken care of?
Well, you know, it's one thing it does. It makes a kid be a kid to age 26, which means that a person can stay on their parents' policy until they're 26 years of age. In years past, but the child goes to college, and in many policies it may end when they're 18, and they either have to get insurance from a source. It's normally very limited. It doesn't cover a lot, and this keeps those people covered under their parents' policies till 26, gives them a chance to get started in life. That's one thing that's already here. Also for kids, it covers all the preventative measures, and so any type of preventative medicine, be it the vaccination or the flu shots, and all of that's covered without a deductible. That's already in effect now. That really is great for kids at this point in time, for Arkansas children, and for the children that the advocates care so much about. So all of that is good news. But we'll remember, and a lot of your members that have been supporting these programs for children, remember Our Kids First, how long it took to acclimate the public to buy free insurance, to get to enter and enroll in free insurance. And so that's what this education process is about. And in fact, what we're talking about right now is that we have to advise the people in Arkansas. It's available, what the costs are, and there's going to be options, variables in there that need to be explained. We got to get ready for that. So it's a giant leap. It's going to take quite a while. We don't want to get off target when we listen to the national campaigns and the politics involved and some of the fear issues in that. What we want to do is be ready for Arkansans. And we've got a $7.6 million grant to start getting ready for this partnership. I've got to get it through the legislative process. We can't spend that money. It's been authorized by the federal government, and we can't spend that without the permission of your state legislature through a committee to authorize an interim appropriation. That's going to be real soon. I sure want the advocates to say, we need this planning process. We need to get ready for the affordable health care, and we have the money to plan it. We need to let the department go forward with it. So there's going to be an alarm going out to members and people who care. It's going to say, call your legislator and just say, we need approval on this. That needs to go forward. Don't want to get that confused with the big picture of the federal campaign and all that. This is just, we've got the money to do this planning, to get ready, and if the legislature says no, I got to send the money back. And we won't plan, and we'll sit here and we will lose this option for our kids in Arkansas.